Just a moment longer as we observe 1 minute silence in respect of the passing of Hansel Lian, our country's first COVID-19 death. And let me say a pleasant and good morning to you members of the media, and thank you very much for coming to cover the Joint Trade Unions Movement statement on the coronavirus. Firstly, JTUM would like to express our condolences to the family and friends of Mr. Hansel Lian, our country's first recorded COVID-19 death. We also wish to extend our support and prayers for all those persons who have tested positive and who are now receiving treatment. We wish them a full and speedy recovery. The Joint Trade Union Movement is aware of some 35 Trinidad and Tobago nationals who are currently quarantined in Maynard, St. Peter's, Barbados. Information coming to us directly from that group in Barbados reported that so far they have received proper treatment from the government of Barbados. In that regard, this morning, JTUM wishes to thank the Prime Minister, Ms. Mia Mottley, and the government of Barbados for ensuring that our citizens, CARICOM nationals, are treated with respect and dignity, whilst at the same time they follow all the necessary pandemic protocols. We call on the government of Trinidad and Tobago to ease any burden on our nationals, all of those 35 nationals, during their stay in quarantine in Barbados. JTUM is also taking the opportunity to commend all workers who are at the front line and who are keeping this country going, even as most of us self-isolate. Special mention and commendation must be made this morning of the TNTech workers, the WASA workers, and other public utility workers, media workers, our doctors, nurses, pharmacists, laboratory technicians, essential industry workers, sanitation workers, postal workers, city corporation workers, our bus drivers, taxi operators, farmers, market vendors and grocery workers, airport terminal staff, custom and immigration officers, social services workers, bank workers, or any worker or group of workers that were not identified here this morning. Special commendation and special thanks to those workers who are outside there now on the front line. JTUM commends and thanks all of those workers who themselves are placing their lives at risk to save the lives of all the rest of us. The Joint Trade Union Movement is also condemning outright, in the strongest possible terms, the physical attack by the security officers against media workers at the San Fernando General Hospital on Wednesday, the 25th of March, a couple of days ago. Media workers are one of the group of workers who are at the front line, bringing real-time information to the public. And this is to the benefit of all the citizens, including the ill-informed security officers. We call on the management of the SWRHA that they must take full responsibility and ensure that this unwarranted attack on media workers never happen again, and at the same time take action against those security officers. The Joint Trade Union Movement also wants to express its concern about employers taking advantage of this current situation. Even as these workers place their lives on the line, it is clear that some employers are taking advantage of this crisis by refusing to pay workers who are self-quarantined. Workers who stay at home to take care of their children, workers who are simply sent home due to slowdown in operation, increasing, some of them, employers are increasing the working hours, thereby increasing the potential hours of exposure. They too are also refusing to put the necessary measures in place consistent with the vigorous health regulations to protect and safeguard the health of their workers. There are workers in different entities that are abruptly being told to go home, and this is without financial assistance or any salary whatsoever. The school transportation drivers who are directly impacted by the shutdown of the schools but have not been paid 1 cent for this year thus far for services already provided. This is services that they would have provided before the shutting down of the schools. They too are out of pocket. While we support the stay-home directive, we must be mindful that there are many families and breadwinners who live day to day and who will be severely impacted and who will have absolutely no means to put food on the table while at home. Mindful of this painful reality, the government must find a way to immediately address the needs of this vast amount of persons and workers who are at the lower end of the economic ladder in our country. And now, JTUM wishes to turn its attention to what we believe is also required at this moment of crisis. Firstly, we wish to commend the government for all their efforts and measures taken so far. We wish to make it clear that while we give full and total support to their measures to contain the spread of this deadly virus and to protect the lives of our citizens, we believe that there are additional measures that must be taken at this time by the government to achieve this objective. So while we support the stay-home directive for 2 weeks, that by itself will not achieve the desired outcome. We believe that this directive should be swiftly matched with aggressive testing, tracing, and containment. JTUM insists that testing should be made available to all public health centers, hospitals, private health facilities, and nursing homes. Simultaneous with the testing, aggressive tracing must be done to identify persons who would have been exposed and the containment of affected persons to have them quarantined. It is clear that countries that have been successful, such as China, Singapore, South Korea, Taiwan, they have all taken critical measures that have worked in flattening the curve and has thus far contained the outbreak in their countries. Among the measures taken by these countries, one critical common measure was strict, vigorous virus testing, tracing, and containment. And therefore, we call for the same approach to be taken here in our country, Trinidad and Tobago. In addition, all our essential workers, especially our medical personnel, who have to interact and treat affected persons, proper PPEs must be adequately provided for all of them at all times. And in closing, JTUM would like to urge all members and all citizens in general to comply fully with the stay-home measure and to continue to follow vigorously personal measures such as washing your hands regularly, don't touch your face, cover your mouth when coughing or sneezing, among many other personal measures. This virus is a real threat not only to lives, but to the entire human existence, and we all must take it seriously. It has no respect for race, religion, political affiliation, class, social stature, or geographical borders. And therefore, we are without choice or option but to take it seriously. Thank you very much for allowing me to make this statement. Are there any questions?
I don't know if you saw the release that amalgamated within their vision what could be
By whom?
amalgamated.
Yeah.
The security company came down to the individual was told that he has none of it in his
Yes.
name, and basically they were supporting that type of behavior. Now, from what we've heard from company's officers is that even police officers are supposed to behave in such a manner. And on previous occasions at the same hospital, you've had those type of aggressive behavior from the same security company. So I know you've called on the SWRAG to ensure that does not happen again, but I mean, amalgamation is all over.
Yes.
I mean, doesn't the company need to take some responsibility as well?
But I think we take it from the top. And so we said that those who contracted that security company ought to rein them in and have them comply with the law and to treat with respect media workers who are performing a specific function, and a critical one at that at this point in time. And therefore, yes, amalgamated security and their management, part of the 1%, believe that they are law unto themselves. But those who are responsible for contracting them must ensure that they not just do their jobs, but that while doing their jobs, they treat with a most respectful way members of the public, and of course, in particular, the media workers. We call for some sanctions, both against the company itself and against those workers who are also will benefit from the information that is collected and reported. What we need in this entire scenario, this unfortunate situation, is to report the facts so that correct measures and action can be taken in real time. And this is why we are saying that not just let people stay at home, but that to have an aggressive testing available to ensure that we determine who had been exposed and who unfortunately may have contracted the virus thus far. We might very well be having it solidify in all of the homes while people are at home. And we say that while we support that as a measure, that by itself is not enough.
So there seems to be, I mean, this coronavirus seems to be the most pressing issue for everyone right now. And there seems to be a political battle taking place between the opposition and the government. One is accusing one of behaving irresponsibly, the other one is accusing the government of cover up and those type of things. I mean, how does that bode well for the overall population in, taking the necessary precautions and following the necessary rules to help prevent the spread of this?
Yeah. I think that's an interesting point because the countries that we are taking pattern from, indeed, I am not with any report, JTUM is not with any report this morning that there's people, governments and oppositions in other countries are detaining themselves with the political fight and so on. That is not occurring. What is occurring, however, is that they have identified the virus as a real threat, and they are collaborating, come together to treat with it in a most unified way. This is unprecedented, and therefore it calls for a type of approach that is also unprecedented. And we are saying that it does not respect government or opposition or persons or political affiliation at all across the board. All of us will be flattened in no time, if we continue to squabble while the COVID-19 virus continue to swiftly make incursion into the country, into the lives of citizens in this country. We are asking that we put all of that aside and perhaps take it back up sometime later. But for now, the priority has to be what is mostly required to save the lives of citizens of this country and to contain the virus. And what we have identified through our international connection and our international discussions with our global union is that those types of approaches those particular countries would have taken would have benefited the citizens of those countries. And therefore, we are calling on the government to do just that, in addition to what has been done so far. Yeah? It is not virus one party or virus the other party. It doesn't ask you if you are UNC, it will save you. If you are PNM, it will save you. Or what race you are. Everybody. And did you see all of the leaders of all of those countries in Europe, United Kingdom, United States, all of them are at risk. Congressmen in US, the Prime Minister of Britain, also this morning, across the board, no respecter of persons or status. And therefore, it is the responsibility of all of us to support whatever measure that is in place to protect the lives of all of the citizens in this country. And that is why we are saying that while we give support to the government, or any government for that matter that would have been in office at this time, while we give support to those measures, we are saying at the same time there are additional things that can be done, namely what I have just described. And official Ministry of Health records thus far is that there are some 66 infected persons with 2 deaths. So you see where we are going with that right now. The exact and precise information, I do not have that with me at this time, except just to make that announcement here to bring to bear the seriousness of what we are dealing with right now. Yeah. So we are urging and calling on our members to support the measures, but at the same time we are asking the government to be mindful that there are quite a significant number of persons in this country who today do not know where the next meal is coming from, who live on a day-to-day basis, and who, because of their own economic situation, their being at home for 2 weeks will be very difficult, and we ask that some form of remedy or assistance be brought to those persons. Yeah, any other? What did you say?